Good afternoon, and welcome to the first edition of Rising Technologists. Today we're going to be educating you on the processes involved with having diuretic renal scintigraphy. This scan is a safe and valuable method for evaluation of renal function, differentiating between obstructive and non-obstructive causes of renal and ureteral dilation, and identifying kidney failure. With us today to help shine the light on the subject are my esteemed colleagues and future technologists, Simone Bowen and Juan Jimenez. Welcome, and thank you for being on the panel. Now, before we dive right in, let's take an up-close look at the kidney and reflect a little bit more on its basic functions. We know it's an organ that filters waste, especially urea from the blood. It excretes this waste along with water through the urine. Urine passes out of the kidney, through the ureters, and to the bladder. With that in mind, let's begin. So let's begin with some pathologies associated with the renal system. What are some common diseases or disorders that prompt a physician to prescribe a renal scan?
That's a very good question. Well, there are a few pathologies associated with the renal system, but since we're limited in time, I'll focus on two that are prevalent. The two pathologies that I will be discussing today are hydronephrosis and uteropelvic junction obstruction. Hydronephrosis is a condition that occurs when there's a backflow of urine from the bladder to the kidney, or kidney stones, and during pregnancy. Symptoms could include nausea, vomiting, urinary tract infection, and fever.
Is hydronephrosis a disease?
No, it's a condition caused by urinary tract infection or kidney stones. Here's an example of a kidney stone in the renal pelvis.
Now, since this scan involves the use of radioactive pharmaceuticals, how is the radiopharmaceutical, distributed through the body?
Well, that's another very good question. After intravenous injection, the radiopharmaceutical travels to the abdominal aorta into the kidneys, passes through the renal arteries, and lastly will be excreted through the urinary bladder.
What can cause an obstruction or blockage in the kidneys, though?
Well, the two most common reasons for obstruction are scar tissue and kidney stones.
So with symptoms being so similar, how is it that you tell the difference between the two?
Running a test such as a CT or MRI will help narrow down the differences for a clear diagnosis. The CT is the first choice, and the spiral CT is used for detecting the difference between a benign cyst or a renal cell carcinoma. A recent study shows that MRI could detect the cause of obstruction in all kidneys with a non-calcular obstruction with a sensitivity of 100%. In 21 kidneys with a calcular obstruction with a sensitivity of 70%. The overall sensitivity of MRI combined with a plain X-ray of the abdominal detection of obstruction was 97%. So both methods are great for helping diagnose the problem area. When the Lasix study is performed correctly, the sensitivity is 90% and the specificity is 95%.
How is the pressure increased on the renal pelvis to determine the likelihood of the obstruction?
That's a good question. With the use of an interventional diuretic such as furosemide, which is injected into the patient based on their weight in kilograms, 10 to 15 minutes into the study if there seems to be a delay in excretion. Furosemide causes the kidneys to make more urine by decreasing the amount of water the kidneys reabsorb as part of the filtering process. There is also an increased flow of urine through the ureters, which make an obstruction in the ureters easier to see.
There seems to be a few ways in which a doctor can misdiagnose these symptoms. What are some of the reasons for this?
In any medical study, there's a possibility for false negatives and false positives. Renal scans are no exceptions. The kidney's functional obstruction can be mistaken for mechanical obstruction. However, once the diuresis increases pressure on the renal pelvis, the obstruction can be overcome. Another reason could be poor or distended bladder. The high filling pressure of a distended bladder can impair washout from the upper urinary tract.
Are the patient's hydration levels important to this scan? In other words, is it something that they have to stay well hydrated, or does that really make any difference?
Yes, poor hydration can lead to poor diuretic response, thus mimicking mechanical obstruction. However, prior to injection of the radiopharmaceutical, it's important that the patient void the bladder because full bladder can slow the drainage from the upper urinary tract, resulting in a false positive finding.
Every patient, as far as I know, is got to be unique with respect to normal variants. What are some of the examples of this?
What makes each patient unique are specific abnormalities that affect the patient's renal function. For instance, mild or non-obstructive hydronephrosis or hydroureter due to vesicoureteral reflux can give the impression of a fixed anatomical abnormality rather than functional abnormality.
With so much technology available today, what makes this method of imaging the kidneys the preferred technique over CT or MRI?
Nuclear imaging provides the technologist with the ability to follow the pathway of the radiopharmaceutical, allowing the technologist to identify the origin and/or cause of the obstruction. Radiopharmaceuticals designed to be taken up in the renal system will provide the technologist a better understanding of the function of the kidneys by following the biodistribution in real time.
What will a technologist encounter when inspecting the images that are taken during this study?
Okay. Once all the images are collected, the technologist will be looking for the biodistribution of the radiopharmaceutical and clearance from the kidneys into the bladder after a specified time indicated to provide critical information physicians need to assist in the diagnosis. Each image taken in a dynamic study will show the biodistribution of the radiopharmaceutical through the renal system. If there is normal washout of the radiopharmaceutical into the bladder in 10 minutes or less, this indicates that the patient does not have any obstruction. Obstruction becomes a factor if there is no washout after the allotted time.
There are some standard curves and quantitative values calculated from the furosemide renal study, which are the time activity curves for each kidney as a whole and half clearance times for each kidney. Region of interest are drawn around each kidney, background regions, and the bladder to generate the time activity curves. Time activities for curves for each kidney will reflect the clearance of tracer into the bladder. If the activity in the suspicious kidney remains in place, then this indicates complete obstruction. Here we have a MAG-3 renal scan after Lasix administration that demonstrates no obstruction with normal response to Lasix of both kidneys.
Okay, well, this has been very informative for our viewers concerned with the procedures and has shed some light on renal scans with Lasix. A renal scan, as we've mentioned, is beneficial in trying to identify the cause of kidney failure or obstruction, as well as give the patient and the doctors alike the opportunity to correct and treat the condition precisely. I'd like to thank my esteemed guests today, Simone Bowen and Juan Jimenez. Thank you again for being on the show. My name is Victor De Jesus, and we look forward to seeing you on Rising Technologies. Thank you.